we have Dr. Abdullah Al-Baghdadi, who has very graciously given us his time, because I know that he is doing a double shift, one in Austria and the other one in Iraq at the same time. So here we are. He's a research physician in the Department of Diabetology and Endocrinology at Medical University of Graz, and his research is actually his interest in how the biological factors impact on the metabolism, and so without further ado, I shall. Can you unmute yourself, Dr. Abdullah?
بسم الله الرحمن الرحيم والصلاة والسلام على سادة الخلق محمد وآله الطيبين الطاهرين. السلام عليكم جميعا ورحمة الله وبركاته. First, عظم الله أجوركم in shahada of Imam Al-Jawad, and inshallah Allah will gather us soon in his hadrat in Kazimiya. In this short presentation, I will try to compromise as much as I can just to keep the time in the limits. Although the topic is very big and there's a lot of things to talk about, all of them are important. Well, first I want to give a small and short definition about metabolism. As part of my research, I focus mostly in metabolism and its what's impact over it from other parts. First, my first and second language is not English, so I apologize for my German Iraqi accent in English. If something not clear, please ask me to repeat it or to explain it. Metabolism, it is the chemical process that occur within your body, within your cells, to convert all like in food, what you consume, what you have, to energy, and that will keep you alive from the biological side. That means everything inside you happen, all the process, all the chemical reactions gathered in that title, metabolism. Which factors affect that? Well, your mental health affected a lot, your nutrition, your medications, your smoking, all what you consume, that affect your metabolism, your exercises, and over that, together with that is your microbiome. What is microbiome? Is the bacteria, the good bacteria which live inside you, especially in the gut. And this all parts, they interact together, like your mental health affect your nutrition taking, like metabolism. When you are in stress, your metabolism, your digestion will not be the same when you are in rest. Your medication will be affected by your mental health. When you exercise, when you do some exercises, that will affect your consuming like for nutrition or even your mental health. All interact together. All of them affect your microbiome, the good bacteria, and your bacteria will affect all that parts. I will go just in a few seconds about microbiome, that it is very important, that one of the trials, the studies, they transferred in mice the microbiome, the good bacteria, from a fat obese rat or mouse to a normal weight mouse. After a while, even with this, without any change in the diet of this mouse, the mouse become obese just by transferring the bacteria. Please, you can search about it online. There's a lot of topics to explain the microbiome and what affect it. But first, what will affect that? Mental health, what you consume, and your exercise. I will start with mental health. First, it is not my specialty. I will go just with the basic information about it. Maybe my colleagues from psychology will talk about it in more details, but I will just give a small and short idea about it. Just imagine with me, It is the night of Friday or Thursday at night. You was in Hosseiniya, relaxed. You heard the dua kumail. After that, you had your tea. You chat with friends. Very spiritual night. You're driving back with your BMW, although you don't have, even if you have another one. You drive back with your BMW home. Everything peaceful. You feel relaxed. Exactly. You feel that relaxed, peaceful, everything perfect, yes? Suddenly, a cat jumped over the road. What happened? You panicked, the cat panicked, you didn't know what to do. You just get like, you hit the brake, the car stopped, the cat over. What happened? You feel your heart beating hard, like fast and hardly. Your muscles tense. Your like all the thoughts will just disappear. All what you had in your mind about thinking of Hosseiniya and all that peaceful moments disappeared. What just happened? Here we have the activation of sympathetic division of the autonomic nervous system. We have the autonomic nervous system, so as it is autonomic, so automatically it manage your body automatically, your heart like rate, spreading the blood for which part. We have in that system two parts, sympathetic and parasympathetic. The sympathetic called fight or flight division. When you are in danger, when you feel you're like there's some risk, there's some emergency situation, your body will activate your sympathetic system, like or sympathetic division, as we talk in that minute when you saw the cat and you feel something can happen. What your sympathetic division will do, that will activate this fight or flight emergent situation. It will give the priority of the blood of thinking mostly for your muscles, that you to fight or fly, to run, escape. It will decrease the blood supply and attention for your logic thinking or your cognitive ability. It will decrease it for your digestive system, immune system, other part of the body that felt in the time of fight you don't need it, or you don't need to escape, to run. Oppositely, the parasympathetic system or parasympathetic division called rest and digest. When you are in Hosseiniya, in hearing dua or drinking tea, sitting home relaxed, so this is peaceful period or time. This is rest and digest. Your body will separate correctly the blood for your cognitive part of your brain, give normal like blood supply for your digestive system, immune system. Everything will be okay. You don't need any extra work for your muscles. Everything in the right position or right place. Indeed, when we worry about anything, when we worry for a long time especially, the sympathetic system will be activated. Even when you are sitting home relaxed, if you worry, you activate your sympathetic division. Your body feels that there is some danger. It should do something. That will increase your stress hormones, which is most normally like the adrenaline, if you heard about it, and cortisol. Cortisol will inhibit your cognitive ability, your immune system, your digestive system, because we don't need it now. It is urgent situation. So imagine if you have it for a long time, for a day or a week. So your immune system will be inhibited, your digestive system, so all your intestinal tract will be inhibited. You'll get a problem with that. Your cognitive ability, you will not be able to focus. You will feel your brain just jumping from one place to other. You feel everything uncontrolled. Does it mean that we shouldn't worry about anything? Should we be careless? Indeed, no, but the psychologists explain that there's two things to worry about. If we divide them, then we watch which part it's good to worry about and which part to not worry about. They said we have two things to worry: things that we can control it and things we can't control it. For example, I'm sick now, I feel some pain or something. Things to control, like to go to the GB, to the physician, to consult him, to explain to him that then he will give me the diagnosis, exercise, nutrition, medications. He gave me a list what to do. To worry about doing that, to follow this advice, to worry about taking the medications in its time, exercise in its time, to eat the right food, to avoid the wrong food. This is a worry on things that I can control. This is healthy worriness, or to worry about something correct. But if keep the time thinking about the complications, maybe what will happen, will that take me to die, will I have this complication, look, then I will keep looking in internet to see what can happen, then keep all the time what will happen for my kids, what will happen for my house, what will happen, to keep worry about something I can't control, I can't do anything with it. So that part is unhealthy. That part will increase your stress hormones. It will activate your adrenaline for nothing, and it will be chronic for a long time. It will disturb your metabolism, it will disturb your immune system, it will disturb your digestive system, cognitive abilities, and you will not be able to do anything correctly. So we have to make these divisions and move ourselves for the correct part to worry about, the things that we can control. But how to do it? Indeed, for many people, they said, yes, I know, I understand, but how to do it? I need some tools. So there's a lot of things to do. I brought the most easy and things that we can apply it back for our car, BMW. Yeah, I'm coming from the German side, so it is a nice car. BMW, from this abbreviations, like B is breathing, M is mindfulness, and W is walking. So how to do it? I feel now stressed, I feel panic, I know it's wrong, my mind just keeps thinking about things that I can't control it, like I said, complications, death or something, but that brings me a pressure that I can't control it. So first what I do, breathe. To move your mind from the sympathetic division to the parasympathetic division, you need to tell the mind that I'm in rest and digest situation. I'm not in war. I'm not in fight or flight situation. So when you breathe deeply, if you just breathe fast because of the panic, you should start with breathing out, then take deep breath 3 times minimum. This will tell your brain that there's no urgent situation. It is normal situation. I'm in rest. So you will disturb the sympathetic division and activate or deactivate the sympathetic division and activate the parasympathetic division, the resting part. Then the mindfulness. Indeed, when we worry, we think about 2 times, the past or the future. Remembering something in the past which make us feel sad, or imagine something in the future, like I said, complication or something. So what I should do here, I should bring myself back to the presence where I'm sitting. So just watch my place where I'm sitting, feel the presence. If there's a voice, watch my breathing. This will keep me away from that serial of activations of the worriness. Now I'm relaxed for a while. My mind pause the sympathetic division and activate the parasympathetic division, the rest and digest. I had the stress hormone in my body, it's already activated, is high, so I need to use them. So I take a walk, like 15 minutes. That will take all the stress hormone, because stress hormone will activate your muscles, make it tense to walk, to do something, to fight, to fly. So you need to take it out, to digest it. So you make a walk for like 5-15 minutes. This will bring together. Indeed, we had it a lot, and sometimes this short, like applying for this 3 BMW will not help if we don't do it in complete packet. So before moving for the nutrition part, I want to, for 2 minutes, apply this technique in a way that you will feel it. So what I will do, when my mind jumps from a place to another place, will think about story to other story, I want to bring it back. You can't stop your mind thinking, but you can take it in a line you want, till it relax, then bring it back in your hand. How to do it? I will move a step by step by giving short ideas for short time. Please follow it with me. Don't judge what I say, don't go behind it, just stay with the word as it's simple. I will start. Please everyone, close your eyes. Take 3 times deep breath with me. First one. The last one. Now, imagine the first person you wish to him or her a good health. Imagine the second person you wish to him or her a good health. Imagine the third person you wish to him or her a good health. Imagine the first city you wish to people there a good health. Imagine the second city you wish to people there a good health. Imagine the third city you wish to people there a good health. Imagine the first country you wish to people there a good health. Imagine the second country you wish to people there a good health. Imagine to a third country you wish to people there a good health. Imagine the world and wish to people in the world a good health. Come back to yourself and wish for yourself a good health. Now give your mind, your thoughts, a freedom to think about anything it wants, but you just keep watching your thought. Don't go with your thoughts. Just watch your thoughts for a while. I will tell you when to stop. Now take a deep breath 3 times again. Open your eyes if you close it really, and just feel the change between now and before. So you can apply this technique anytime you feel stressed, you feel like worry, or even like to have mindfulness. For example, before praying, before doing pray, just do it for 2 minutes, then you can. It is very easy. 3 times deep breath, then you imagine like in categories, 3 people one by one, 3 cities one by one, 3 countries one by one, 3, then the world, then you come back for yourself. So you bring your mind, your thoughts in your control in that organized movements. This will relax your mind from jumping for other like thoughts. Then you give your mind a freedom to think anything it wants, but you should keep watching, never go with your mind, and that will give you a seconds of peace for about 10 seconds. Then you take deep breath for 3 times, and that's it. When you finish, just take a while and feel the change, the difference. So this was very short talk about the psychological or the mental health part and its effect on our health. I will jump for the nutrition or what we consume. I will talk for you. Indeed, unfortunately, physicians talk usually just about medications. Yeah, medications is part of what we consume. It is very important in our like acute disease treatment, but for chronic diseases there is always better alternatives or combinations. When you keep your nutrition, your mental health and your exercise together in the right balance, even you will decrease your need for medications, and that will keep your metabolism balanced, and then after, of course, your disease will be treated or even revealed. Indeed, when we talk about metabolism, what diseases we talk about when we have any problem with metabolism? Diabetes, hypertension, and even cancer, and many other like immune disorders like allergy. When we talk about allergy or like eczema or many things like this, all has its base, its roots in metabolism, in disturbing of metabolism. So when we make the balance in the metabolism, we protect ourselves from these diseases. Even when you have it, you can bring it back. We have many patients, even after 10 years of diabetes, we brought them back for non-diabetic patients, that they are not diabetes anymore after 10 years, just by nutrition and like exercise together with mental health. We didn't stop medication, of course, immediately. We do it gradually till we brought the patient in his correct balanced metabolism. With nutrition, I will mention like very basics but very useful tools. First, I will talk about the ratio. The first problem what we face with people that they talk about quantity, how much should I eat? Indeed, before of thinking about how much you eat, you should think about the ratio in your plate. The first easy rule: eat in one dish. Bring a big dish, but put everything what you're gonna eat in that dish, and never eat anything outside this dish. I think this is very easy, yes? Put everything. You have to keep these 3 ratios. First, 50% of your plate should be vegetables and fruits. Minimum half of it vegetable and fruits. Salad, sauce, anything, we can say it is vegetables and fruits. 25% should be protein. When I talk about protein, I talk about meat, white meat, red meat, fish, chicken, beans, lentils, all this protein source food or protein rich food. that should be 25% of your dish. The last quarter, the last 25% should be carbohydrates. When we talk about carbohydrates, we mean bread, rice, macaroni or pasta, as you call it there, potato. All these are carbohydrates. But indeed, we have two types of carbohydrates in our main categories. We have the complicated carbohydrates and simple carbohydrates. Complicated carbohydrates like whole grain bread. So it is together with the cover of the like wheat or something. It's called whole wheat. And we have the simple carbohydrates like sugar, white flour. This called the simple carbohydrates. Indeed, what I missed in giving the presentation, please observe the next slide with the curves. What will happen when we eat simple or complicated carbohydrates? This yellow curve explains when you eat something complicated. When you eat complicated carbohydrates, its digestion in your body will be slowly. So it will take like about 4 to 6 hours. That will give a time for your body to digest it and to take use of it. This horizontal line in the middle, it is the need of your body. So when you eat complicated carbohydrates, you give a time for your body to take it for its need. When you eat simple carbohydrates, it will be very fast digested, like sugar, like white bread. It will be digested very fast in your blood, so it will go over your needs. So if you see the horizontal line, it will go over very fast over your needs. Your body don't need this extra sugar in the blood. It will send it to be stored as fat because you don't need it. In the same time, it will shock your metabolism. It will make disbalance in your metabolism. And it will be digested very fast that after 2 hours you feel hungry again and you need to eat again, and the cycle will be. But when we eat complicated carbohydrates, your metabolism will be balanced. Your body will take the advantage of this food in the correct time. What else we can do to keep the curve like horizontal? No, not yet, Afzal, sorry. So we had to keep this 50.
Tell me when you are ready.
Yeah, we have to keep this 50% of vegetable and fruits in our dish. Every dish, breakfast, lunch, dinner, should include 50% fruits and vegetables, 25% carbohydrates, and will be very good if it complicated carbohydrates like whole grain, and protein, 25%. Then this is about the ratio. We talk about the quality. Which lifestyle is which diet is the best one? Well, there is many studies talk about the heart health, your metabolism health, but there many studies confirmed, and there's one on 73,000 volunteers. They follow different diets like vegetarian, vegan, who eat just plant-based diet, meat eating like 5 times a week, like most of Middle East people. I don't know about you. Like Iraqis, they eat almost every day red meat. So they compare which one have the less like heart disease, diabetes, and all chronic diseases, and even cancer. They found the Mediterranean diet. It related to the like White Ocean, or the countries around like Greece, Italy, Spain, but they find together that they have in combinations that those people, especially that the real healthy side of the country, not the city side, which eat fast food and junk food, they eat, for example, according to this, this is just example. You can find in internet more details about Mediterranean diet. They eat, for example, 1 to 2 times per week fish, 1 to 2 times per week chicken, more than 2 times a week vegetarian meal like hummus, beans, lentils, others, all this like veggies, and they eat maximum 1 meal per week red meat. So red meat is once a week or even less, sometimes once every 2 weeks. They found that those people have 20% risk less than those who eat almost every day meat or 5 times a week. 20% less risk for diabetes, cancer, and even hypertension. This is about the quality of the food. Now we talk about the time. Of course, the main one is to eat 3 times a day. Between the meal you are fasting, you don't eat anything. But for a perfect health, there is what called intermittent fasting. It is indeed very easy, but if you apply it within a month, you will feel amazing change in your health. It is that easy. I will give just an example of what we recommend. Like, for example, you eat 8 hours per day all your food, and 16 hours you are fasting, except for water, pure tea. That means you don't eat any you don't add anything for the tea, no sugar, no sweetening, no like milk, pure tea or pure coffee. This is in the 16 hour of fasting. But within the 8 hours, for example, you eat your first meal at 12 o'clock, 12 p.m. You are in the open time for eating anything you want, with respect for what we mentioned, like one tablet and that Mediterranean diet. And the last meal will be at 8 o'clock p.m. So you eat from 12 till 8. Nothing before 12 o'clock except water and pure tea or pure coffee. And after 8 o'clock p.m. you are fasting except for water, pure tea or pure coffee. Within the 8 hours you eat anything you like. For balanced, like many people, they said we can't eat anything, so I may recommend, for example, 12 o'clock you eat your first meal. You make it like perfect meal as we explained. The next one will be 4 o'clock. You can make something light that you'll be able to eat later, because many people, if they eat something heavy at 4 o'clock, they will not be able to eat at like 7:30. And 7:30 will be the last meal. Then from 8 o'clock you will start your fasting. You eat nothing except, as I mentioned, tea, pure coffee, pure tea, pure coffee and water, till the next day 12 o'clock. You can move the time, like you make it from 10 o'clock in the morning till 6 o'clock p.m. But all what we need is 8 hours of feed time and 16 hours of fasting time. You can have 1 day per week, we call it cheating day, free day. So you're gonna visit a friend, there's a like evening, they put some sweets, it's okay. Once a week you are free. But if you keep the habit of or the regular fasting for at least 6 days a week, this will be perfect. If you apply all these 3, you will feel your mental health will be very like balanced, everything perfect. you will feel all your, like your digestive system, your immune system, your heart circulation, everything will be balanced. I want just to mention something before finishing, that even your behavior, your thoughts, and your judgment will be changed. In a study in Germany, in Lübeck University, they make this trial. Group of people, for a week, they give them in the early morning breakfast rich in carbohydrates, more carbohydrates and less protein, like more bread, more rice, more carbohydrates, and less protein, and of course less like vegetable and fruits, for a week. And they examined their thinking. One of the tests they apply, that the examiner give this test, they all, like, he play a role with the subject. He offer him, he said, this is 10 euros, we have to make a deal about it, or if you reject it, we will lose both. I will offer you 2 euros for you and 8 for me. So the subject had either to refuse or accept. First week, sorry. So first week they give them more carbohydrates and less protein. Second week, the same people, they give them more protein and less carbohydrates. They saw the majority, or big percent of them, in the week when they received more carbohydrates, they refused this test. They said, we don't accept, we lose, but we don't accept this. In their reflection, they said, we feel like we were very sensitive, we feel in respect, we feel this touch our dignity, so we get angry with it. In the period when they ate more protein, they were more flexible. Many of them accept this deal. Even they refused it in the last week. When the week they eat more protein, they said, well, in their reflection, that we win both better than lose both, even if it less for me, just by changing their diet. Finally, I want to talk about the exercise. It is a main part of our health. I will mention that in very simple techniques, at least 5 days a week. You can do like 2 days of this exercise, 1 day free. 5 days a week. You have two options: 15 minutes of home training. There is many applications in telephone. You can find free home training, free home exercise. You can download it. It will give you very light exercise that you can do home. Something like what we shared in the beginning of the video. Something light. Or you make 14 minutes walk. To walk for 30 minutes continuously. And will be perfect if you do 1 day like 15 minutes home training, and 1 day 40 minutes walk. This is the minimum for your health regarding the aspect of training and exercise. Finally, I want to mention a hadith for Amir al-Mu'minin Ali ibn Abi Talib alayhi salam. He says, don't make your stomach a cemetery for animals. Allahumma salli ala Muhammad wa ali Muhammad. Thanks a lot for your listening. Alhamdulillah that I had the opportunity and the honor to talk with you. And inshallah we will meet again with a lot of pleasure for more talk.